Hi, today we're going to be talking about tumor ablation. Have you heard about it? It's when you use heat, cold, or even other energy sources to essentially zap or destroy cancer. And we can do that essentially anywhere in the body from head to toe. If you have been recommended tumor ablation, you might have questions like, what is it? How does it work? What can I expect? What are the risks? So let's talk about it. Tumor ablation is an alternative to removing a tumor, to a surgical resection. And it's a minimally invasive option that can be used to treat and sometimes cure cancer. So essentially, that's a technique that we use, a very special technology, which most of the time includes needles that are inserted into the tumor, and they can cause extreme heat, cold, or even an electrical current or ultrasound energy to destroy the tumors. And I will be talking about this in detail to you. It is most often used to treat localized tumors in the liver, kidneys, lungs, or bones, although can be used anywhere. Unlike surgery, ablation does not require large incisions, which means less pain and faster recovery time. But the main advantage is that you can precisely target and eliminate tumors while leaving the surrounding health tissue largely untouched. So you don't destroy your healthy and normal tissue, which you may need it. In this video, I'll be talking mostly about the ablation treatment of liver tumors, and I will be talking about ablation of renal cancers and lung cancers in a separate video. So there are different types of tumor ablations. The oldest one is the radiofrequency ablation, which uses electrical currents to generate heat to kill the tumors. But nowadays, most of the time, if we're gonna use heat, we use microwave ablation, which uses microwave energy to more precisely heat and destroy these tumors. It is also quicker than radiofrequency ablation. We also have cryoablation, when we use extreme cold to freeze these tumors and kill cancer cells. And although these are the most common ones and the ones that we use the most because they have more data and have been around for longer, there are newer methods that have been using more and more depending on the locations. One uses a device called electroporation, that you use an electrical current to essentially run electricity to electrocute the tumors, or histotripsy, where you target an ultrasound wave to heat up these tumors. And histotripsy has the advantage that it does not require a needle, but the data about those are still pending. Again, the nice thing about ablation is you can target the tumor and at the same time spare the normal tissue, in this case, the normal liver tissue. As you know, you need your liver. And how do we make sure we're treating the right spot? Well, basically, the way you find these tumors is with imaging, right? Like a PET scan, a CT scan, or an MRI. So it makes sense to use the same imaging spots to treat these tumors. In our case, we're lucky that we have access to several imaging modalities at the same time, and we tend to use all of them, including CT, ultrasound, and sometimes even MRI to treat these tumors. It's like having a GPS system to treat cancer. When you do surgery, you often have to remove part of the normal liver tissue around the tumor, and sometimes actually a big part of liver tissue. So not only there is a long recovery time, but there is a limit of how much normal liver you can take before you run out of liver. With the ablation, this is not as much of an issue. Of course, with the ablation, you also will destroy some of the normal tissue around the tumor, in this case, the liver tissue, because you have to treat a little bit of the normal tissue around to make sure you kill all the tumor cells. We usually target for about 5 to 10 millimeters around the tumor. But even if you're treating a margin of 1 to 2 centimeters around the tumor, is only a few milliliters of normal tissue that you're treating, which is very minimal, considering your liver has 1,200 to 1,800 mLs in total. With the surgical procedure, you may be removing 500 to 1,000 mLs of normal tissue. Also, we need to look at the data, right? So when the data shows that for small tumors, which we call small when they are up to 3 centimeters, when you have complete ablation and clear margins, outcomes are essentially similar to surgery. And many studies have shown that for these small tumors, ablation provides comparable survival and curative outcomes compared to surgery. So in this video, I'll be focusing about the use of ablation techniques for treating liver tumors. And they can be used for treating either primary liver tumors, which are tumors that start in the liver, such as an hepatocellular carcinoma or cholangiocarcinoma, or metastasis, which is when you have a tumor that started somewhere else, let's say the colon or the pancreas, and they went to the liver. So again, in general, ablation is best for smaller tumors. Again, usually less than 3 centimeters, although in some cases we can use for larger tumors. We also will only use ablation if you have a small number of tumors in the liver, usually less than 3 tumors, although every situation is different. Of course, for larger tumors, usually surgical resection which is when you go in and actually remove these tumors, the results are better. But sometimes surgery is not an option, either because the resection is too difficult or because the patient has other medical conditions that preclude having a big surgery, or the patient does not want surgery. We also have other interventional treatments that can help with that, including what's called the Y90 radiation segmentectomy, when we inject little radiation beads that will destroy the tumor, or chemoembolization, which is when we inject chemotherapy directly into the tumor. But we'll be talking about those in another video if you're interested. So we have all these tools, all these ablation tools, and have to decide which one's best for you. And how do we do that? Well, it will depend on the tumor size, location, and the type of tumor that you have. For liver in particular, we tend to use microwave ablation because it's fast and effective. Also because it cauterizes the tissue and it has a slight less risk of bleeding than the cryoablation. The downside of the microwave ablation, it may require general anesthesia since it is more painful than the cryoablation. And it can also be a little bit more risky if we're close to some structures like the bile ducts. The cryoablations can be more gentle in the bile ducts, so if there is a question, we tend to use that. We also sometimes don't like to use microwave ablation if the tumor is closer to the diaphragm or the chest wall, which sometimes can have more pain after the procedure. The cryo tends to be less painful afterwards. The downside of the cryoablation is that it takes longer. It takes about 10 minutes per cycle to freeze the tumor, and usually we have to do at least 2 cycles. And after the cycle is done, we need to wait about 5 to 7 minutes for the ice ball to thaw. Therefore, just to freeze one tumor, it will take about 30 to 40 minutes, while the microwave takes only 5 minutes to do the same thing. So how the procedure is done? We use sedation or general anesthesia depending on the patient and the location of the tumor, and also depending if we're using microwave or cryoablation. So in all cases, we use different imaging modalities which are available to us, including CT and ultrasound. Sometimes we use them at the same time so we can precisely visualize these tumors and insert the probes in the tumor without damaging anything around it. We can use one or more probes. We often pick these tumors like chopsticks, putting probes adjacent to it. And we know these probes have a certain amount of energy that they will produce. And based on laboratory testing, we have a general idea what to expect. But then, while we are doing the ablation, we can visualize the area that is being treated at real time, and we can be very precise. So we literally sit there and watch the treatment zone grow. So basically, my job is to insert these probes precisely where I want, where I think it's gonna get the best treatment for the tumor, and then I just sit and watch. The duration of the treatment can vary from half an hour to 2 hours, depending on which method we're using. Like I mentioned before, cryoablation would take a lot longer than microwave ablation, or how many tumors we're actually treating. What should they expect after the procedure? Most patients will go home the same day at the procedure. They should expect to have some discomfort or soreness at the treatment site for a few days, but should get better fast. It's also common to have fatigue and a low-grade fever, which is basically your immune system fighting to remove the dead tissue. So patients may feel a little crummy after the procedure, but most patients will return to their normal activities within a few days to a week after the procedure. And of course, we'll see you in the office to discuss the follow-up protocol with imaging to confirm that the treatment was successful. And of course, you're wondering what are the possible complications with this. And overall, the procedure is very safe and complications are less than 1% if performed by a physician who does a lot of this, like us. And I know, like I mentioned before, you may feel not great for a few days. Complications are rare. The main complications are bleeding, internal bleeding, or injury to organs next to the tumor site. But most of the time, these complications can be predicted ahead of time, and we'll take all the precautions to try to avoid them. Of course, in some situations, if we think the risk is high, since the tumor may be next to another organ that we cannot push away, then we may decide that the ablation is not a good option for you, and we may need to talk about other treatments. Ultimately, there's a chance of tumor recurrence with these procedures, and that's why we need to keep watching them and repeat imaging afterwards. If there is a recurrence, it can be treated again with a repeat ablation or other techniques like surgery, Y90, or chemoembolization. Yes, ablation can be repeated, and there's actually no set limit of number of ablations that we can do. Of course, depending on the location and number of lesions, since we're not actually damaging much of the normal liver tissue. So I'm sure you're also wondering what happens to the tumor after the ablation. And this is a very important question to understand. You see, what happens is that once you freeze or burn the tumor, the cells are destroyed. They fracture and they fall apart. And the components of that cell are then absorbed by your own inflammatory system. And that's actually one of the exciting parts about it, because people are really exploring whether or not combination of ablation and immunotherapy might be a new opportunity in terms of treatment of cancers. But the important thing for you to understand is that the imaging appearance is not going to go away immediately after the ablation. Actually, it's quite the opposite. If you repeat a scan the next day or a couple months after the ablation, it will likely look bigger than before because we treated the tumor and the margin around it. And that's why you need somebody that understands imaging to look at your pictures. We want to make sure that this ablated area does not take up any contrast, which means the cells are dead and don't have any blood flow. If they have blood flow, they will take up contrast. Most insurances will cover tumor ablation for eligible patients since there is a lot of data and experience supporting these procedures. But my team will work with you to confirm this with your insurance. I hope this video may give you a better understanding of tumor ablation and how it might fit in your treatment plan. Remember, every patient is unique, so it's important to discuss your options with your interventional radiologists. These techniques are not available in every medical center, and really there is a lot of nuance to the procedure, so it's very important to go to a center that specializes in these procedures and that has a lot of experience in it. If you have more questions or want to learn more, feel free to visit our website or contact us directly.